as we know, as a community of Parkinson's disease researchers and clinicians, primarily, Parkinson's disease affects people of all ethnicities, ancestries, and geographies. And yet for many years, research efforts have not sufficiently reflected that heterogeneity or sought to explore how PD is expressed in various populations. The research that was done was disheartening, demonstrating that people with PD from historically marginalized communities were experiencing delayed diagnosis, more severe symptoms, inadequate treatment, and worse clinical outcomes. So here are some examples of the challenges that were identified. There was research done, but we found that there were inequities in how care was being delivered. So for example, Latino people with Parkinson's were 40% less likely, and Black people with Parkinson's were 30% less likely to even see an outpatient neurologist for their Parkinson's as compared to whites. And this was reflected in other neurologic conditions in addition to Parkinson's disease. Black people with Parkinson's presented to medical attention at later stages were more likely to underreport disability, had lower utilization of outpatient rehab services, such as physical and occupational therapy, and had lower rates of deep brain stimulation referral. So all these examples of challenges led to a whole series of questions that are starting now to be answered. So question number one, are there, and if so, what are the differences in Parkinson's disease among different groups across ethnicity, ancestry, geography, socioeconomic conditions, and gender in various aspects of Parkinson's, which would include prevalence, symptoms, progression, treatment, and outcomes. And when these differences are identified, what can these differences be attributed to? Social determinants of health, comorbidities, or inherent differences in the disease itself. And finally, and ultimately, how can we use all this information to provide more equitable care across various populations? Now, another crucial element necessary to ensure equitable care is to ensure clinical trial participation in historically marginalized communities. And we know through various research efforts that there are tremendous barriers to research participation, which exist in historically marginalized communities. And this has been borne out in various research papers over the years. However, it isn't all negative information. We are making some headway because although clinical trial participation has not reflected the ethnicities of the population of people with PD in the United States, for example, there have been efforts, one known as RECRUIT, which was a trust-based cluster randomized minority recruitment trial, which was layered on top of 4 traditional NIH-funded parent trials. And that sort of effort has worked to improve those numbers, and we are starting to reap the benefits of that, although there is a long way to go. Our patient or person with PD panel later will have a lot to say on this topic, and we definitely look forward to hearing their perspectives. Now, with all these crucial questions that needed to be answered, APDA held the first of its kind Diversity in Parkinson's Disease Research Conference in 2019. And hopefully some of you attending today were there in 2019. And that was in person pre-COVID. And in attendance at that meeting were all sorts of stakeholders in the question. And that included people with Parkinson's, care partners, patient advocates, doctors, nurses, researchers, research coordinators, social workers, people working in academia and community hospitals and industry and nonprofits. And hopefully our attendees today reflect that diversity in attendance as well. And the conference consisted of lectures, moderated discussion, and a patient panel as well. And out of the conference led to the establishment of this APDA Diversity in Parkinson's Disease Research Grant, which is a 1-year grant that APDA funds to study health inequities and or differences among understudied Parkinson's communities. And that is broadly defined across the spectrum of ethnicity, ancestry, geography, socioeconomic conditions, and gender. And as already mentioned, current research has established that diagnosis among Parkinson's disease may be delayed in certain understudied communities. Some understudied communities are less likely to receive quality Parkinson's care. Clinical trial enrollment needs bolstering in understudied communities. And the differences in clinical features, response to treatment, comorbidities, prevalence, natural history may vary among understudied populations, and that has not been fully explored. And we asked for projects addressing one of these 4 issues. And over the past 4 years, we have awarded 6 of these unique grants. And these 6 recipients are here today to present their research results to you. And we are very excited to give them this platform to share their findings with you. And these researchers are Dr. Chantel Branson, Paula Reyes, Dr. Jennifer Goldman, Dr. Erin Foster, with Dominique Woodhouse, Drs. Laura Prieto and Luis Columna, and Dr. Karen Hegland. And you will have a chance to hear from all of them today about their projects. Now, before we start, I wanted to point out that we are now open to accepting letters of intent for next year's grant cycle, not only for the Diversity in Parkinson's Disease Research Grant, but for all our grants. And the URLs are up on the screen now, and we will put them in the chat as well. So we certainly encourage our attendees to apply for our next grant cycle.